Welcome everyone to the second episode of my podcast. Today I have the pleasure of having again here Stephanie Seolin. Even though this is the second episode, so you might be thinking, well, was she on the first? No, she wasn't. So how is she here again? Well, she's here again because my channel has some 3 years, and back in 2021, I think, we made a collab. Back then, I was still recording everything in Portuguese. My channel started as a medical English channel, and Stephanie was pretty much doing the same on Instagram. So back then, I saw her work on a group we were both part of, which is USMLE Brazil. I believe many countries have such groups. I saw she made an announcement there, which is entirely understandable because I made an announcement there as well when I started my channel. And so I saw she was doing pretty much the same thing and invited her to record a video. And it's still to this day one of the videos people like the most, especially because it works like a talk. It's a bit more informal, a bit more fluid. I think people like that a lot. So thank you for coming back, Stephanie, and especially since she has just graduated. She is a brand new medical doctor, so it must have been extremely busy for her and hard to make some time to come here today.
Hello, Ricardo. It's such an honor to be here. And of course, I would make some time to be here. I love your work. I love your channel, also your Instagram page. So, of course, I would make some time to be here. And thank you so much for having me.
And since I started this podcast with the idea of talking to physicians and medical students in different countries, particularly those who went to different countries. Hold on, let me see if my microphone isn't getting some interference from my headphones here. But particularly from people that went to different countries to study medicine or to spend some time as physicians, as med students, Stephanie recently went to New York and to Genova in Italy. New York is not in Italy. I think that much was clear. And she has just graduated and she also has a medical page on Instagram. So I believe that would be a great place for us to start with. I think you went to New York, it's been like 6 months, am I right?
I was in New York in March. So it has been, I think, March, April, May, June, 4 months, about 4 months.
4 months. And we had already talked about this before, but I have to ask it here anyway, because my followers weren't hearing that part. So, how did you decide to go to New York? How did you decide to go to the United States? And why pick this specific city in this specific date? How did things work out?
Well, so I think maybe it would be nice to mention that I lived in the US 10 years ago when I was a teenager. So that's where I learned English, by the way. So I lived there from 12 to 15 years old. And I lived in Kearney, New Jersey, which is a town that is very close to New York. So that was basically, a very strong influence for me to choose New York to go. And the date was basically because of the conference that I went to. So I got a paper that was an abstract that was accepted to be presented at the ACC, American College of Cardiology, and there was a World Congress of Cardiology that was, together with the ACC in March, in the beginning of March. So basically, that's why I wanted to find something close to New York, close to New Jersey, and it needed to be close to the conference so that I would make just one trip and I wouldn't have to go and then come back. So basically, I wanted to go to the ACC, the ACC conference, and also have something after it just so I would make the trip count, kind of like that. So I wanted something in March so I wouldn't spend, tons of money with the visa, with the documents, with the, plane ticket and everything, just to go and stay for 3 days. So I was like, I need to find something in March just so I can make everything count. So that was basically why I went in March, and that's why I went to New York, basically.
Just to make an addendum here, the American College of Cardiologists was in New Orleans, so it's close to New
Yes.
York, based on
No.
the point of view of someone that's coming from Brazil.
Yeah, yeah.
It's in the
Yes,
same
that's
country.
true. That's true. Well, for us, a 3 hour plane ride is not that long, but it is a long trip. Like for Brazilians, not that much because we have pretty much a continental country. We're very big. But yeah, it was really, it was a long flight, but I just wanted to stay in the US for longer. Let's put it like that. But New Orleans is very, far away from New York.
Stephanie is making my work here extremely easy because she posts a lot on Instagram, so I will have plenty plethora of pictures to illustrate your talk with later. There's plenty
Yeah.
of pictures both from New York and from Genova. I barely don't even have to ask her to provide me pictures. I'll just rip it off her Instagram.
Yeah, yeah. Definitely, yes.
So, how did you actually manage to go to there, to go to New York, and to go in the condition of a medical student? Because I believe this is one of the most important points. I have some experience myself. When I was in university, I studied at the Federal University of the State of Rio de Janeiro. I also tried to spend like a semester, 6 months in the United States, do a hands-on experience there. And my university pretty much told we have a memorandum of understanding with the University of Michigan. And if you want to have an accredited experience, you have to go there. And then I contacted the University of Michigan, and they were like, well, yeah, we had a memorandum of experience, of understanding, which expired 5 years ago.
Oh my God.
This is extremely common. I've seen this kind of experience very often, and I've
Yeah.
checked many websites for different universities and different hospitals, and it's not rare to see, for example, people ask for 1 year of prior 1 year of prior notice for you to apply
Mhm.
12 months before actually going, for example. So I believe this is one of the hardest parts. Going to the United States is not as hard. Going to the United States as a physician, as a medical student, is extremely hard.
Yeah. So basically, I'm going to start off by saying this is very, very personal. So each person that you talk will have had probably a different experience with this because we have many ways to get a clerkship or an observership in the US. The most common way and the most, how can I say this, regular way would be to go to the university's website, go to the hospital's website, apply. So there will probably be an application area where you can apply. Some of them will ask you for tuition, documentation, maybe in an application process that is long and, you know, and it's not impossible to get something like that. It's not impossible to get an opportunity like that. You can basically send emails to 50, 100, 200 doctors and get one reply back, but it is possible. Even before I got this opportunity, I had tried other opportunities, not in New York, but in Boston. And I got one reply back. I just couldn't go to Boston. First of all, because they couldn't have me on those dates, so they couldn't have me in March, and also because I didn't have anywhere to stay. So it was easier for me to go to New York because I had a place to stay. Um, but yeah, basically, you can get an opportunity like this through email, and then you don't have to pay a tuition or go through the other processes. But it is a little bit harder, I would say. But you could try because it's totally worth it.
And how did your university back here in Brazil regard it? If I'm not mistaken, you went there, but it was not technically part of your study. It was more like a research experience.
Yes, it was a research experience. And back in Brazil, I was in surgery. My rotation was in surgery. So basically, I had to talk to my university and ask them to accept it as valid hours here in Brazil, which is also a very personal situation because some universities will not accept this. My university accepted it, maybe because of the good relationship that I have with, everyone in there. They knew that I was going to a great opportunity. They knew that I was going to improve my connections, my networking, and they decided to let me go and count my hours as part of my curriculum. And also when I got back, and it was a shorter time. And when I got back, it was a very short time. It was just 4 weeks. And when I got back, I went straight back into my regular rotations. So it was basically, personally, it was possible for me, but I don't think I can give you guys, whoever is watching, a guarantee that your university will accept this. It's very personal.
So perhaps we could go first to the United States and then to Italy, or perhaps we could do them both at the same time. But I believe
Yeah.
what most people must be interested in, except those very particular cases of people that actually want to go to these very specific places, is what are the differences. So you spent like a month in New York, in the United States, and you had
Yeah.
lived prior to this in the United States in your adolescence, and you went to university here in Brazil. 6 long
Yeah.
years, I believe, as most of us.
Yes.
So,
Yes.
what was the greatest difference between medicine as a medical student, of course, in Brazil and in the United States?
Well, I believe that, well, this is not something that I saw a lot because, as I told you, I was in a research, so I was having a research experience. But from what I saw from a distance, not directly, you know, from what I saw at the hospital and everything, I saw that the system is different. So, not just as a medical student, but in the US, they do not have a public health system, which makes it a lot less accessible. This makes health a lot less accessible to everyone. So, I saw that the people who had access to health were not that many as it is in Brazil. So in Brazil, we have contact with a lot of patients all the time. The hospitals are always packed, always full. And in there, I didn't see, that much movement. Like I didn't see a lot of people all the time. Maybe because it's paid. Maybe because the hospital that I was at was not, I was not in the emergency care also. So maybe that's why as well. But I think that in general, this is something that we can say about places that don't have public health systems. People don't go as much to the hospital as they do here in Brazil. And also, I think that not just in the US, but also in Italy, as medical students, we don't get to do a lot. We get to watch, we get to learn, obviously, and discuss cases and, you know, diseases and all of that, but we do not touch the patient as much as we do in Brazil. I think this is, in general, I think people who come to Brazil, they comment on this as well, that they get to do a lot. People that come as exchange students, for example, they get very excited because they learn to suture, they learn to do a lot of things that they don't get to do in their home countries. And I'm not saying that it is impossible for you to do those things, because when I was in Italy, they did give me some opportunity to do some things, but it was definitely not as much as I have here in that I had here in Brazil as a medical student. I'm still getting used to the fact that now I'm a doctor. But when I was a student, I did have a lot of opportunity to do a lot of things. And when I was abroad in the US and in Italy, it was very, very difficult for me to have, direct contact with patients, or even to have opportunities to do things on patients, to suture. I didn't suture, for example. I didn't do anything that I think is risky, I guess. I was just there watching, discussing, but from a certain distance, I would say. So I think this was the greatest difference. I don't know if it's because they do not have a public health system. In Italy, they do, though, not in the US. But in general, I don't know if it's because of this, or if it's just because it's their culture. Like culturally, maybe they do not allow students to do much, to do a lot. Or maybe because I'm comparing it to Brazil, I think that is little, but maybe it's not even that little. It's just that in Brazil, we get to do so much. Maybe because we have a lot of work to do. So they never refuse work. They never refuse any, medical student who wants to help. So maybe that's why, I don't know.
There's no such thing. There's no such thing as a observership in Brazil. Every experience is a hands-on experience. Get to work.
Yes,
Go do something.
exactly. We don't even have this term observership here in Brazil. It's only like hands-on experience, because you will always get to help because we need the help. So maybe that's why we allow students to do so much here.
But that's a very tough debate, and we are talking here about medical students, but this also applies to residents, for example. I think there
Yeah.
have been studies, and here is my great source. There have been, where is the study? I'll check later. But there have been studies that have shown people performed surgery on by residents, for example, have higher rates of complications than people performed surgery by attendings. And this is pretty much obvious. The more experienced the professional, the better the work, so to speak, whether it's intellectual or manual or both, as we could, for example, classify surgery, both intellectual and manual. And there is this strong debate about, for example, how should residents, surgery residents, for example, learn to perform surgery? Should they actually learn to perform on the patient? Because this brings increased risk to patients. And more we have like virtual reality systems, and we have many simulation devices. And personally, I believe that's the way things will go. We'll have more and more simulation virtual devices, up to the point you can only perform your first surgery on a patient when you've passed some kind of test on the simulation device. I think this is most likely where we're going to. But here we are talking about something even prior to that situation, which is, should a medical student learn to suture, for example, or to intubate someone, or to place a central venous line? And there's a strong argument to be made that this should be based on necessity. Do you have enough professionals to perform those things? But
Yeah.
I think we have the good side and the bad side here in Brazil. I'm somewhat against just letting anyone perform medical procedures, having a brand new physician, for example, because this is the way things work in Brazil. Any physician, any doctor can go and perform neurosurgery, at least according to our law. That's allowed. And I don't feel safe to do these kinds of procedures, for example. I think we need better training. Whether that should be in medical school or in residence, I think is the great question. Based on what you've seen on the United States and in Italy, have you had contact with other medical students? How do you think these different approaches influence on their preparedness, on people's abilities when they leave medical school?
I think they feel very unprepared regarding procedures, but they are very good in theory. You know what I mean? Study wise, they are very good. I noticed that medical students, I didn't have any contact with American medical students from the US because in the research that I was, there were no other medical students. But I can talk about Italy in this aspect. They were so prepared, theory wise. They knew everything that the professor would ask. They were prepared to answer. They were very prepared theory wise. Especially, I don't know if you know this, but in Italy, all the tests, practically all the tests, the exams are oral exams. So the professor can ask basically anything about anything at their test. So at their exam. So I think they are very prepared in theory. But practice wise, they are not, they feel unprepared. And that was a constant complaint. I heard this from medical students a lot there in Italy. They were like, they really wanted to get to do stuff and they were not allowed to. But I also think that this is not so bad, I would say, because in those countries, for you to work as a doctor, as a medical doctor, you have to go to residency. As opposed to here in Brazil, where you don't have to go to residency, you could just start working. In the US, you have to. It's an obligation. You can't work as a doctor if you don't go to residency. So I think that even if they don't have a lot of practice during medical school, that's not a huge problem because they will get to practice in residency. And I think that their residencies are amazing and they have really great programs. So I don't think they lose much by not being so active during medical school. In Italy, though, I believe I'm correct about this, but I would have to research a little bit more. But from what I remember that they told me, you can work right after completing your medical school training. However, you can't work with certain specialties. You can't, not certain specialties, with certain types of work. You can't, for example, work with emergency, like more serious emergencies or things like that. But you can, for example, do primary care or occupational medicine. So you can do, this I'm sure of. I'm just not sure of which types you can do. But you are allowed to do some things. There is probably a list of things that you can do. But right after you get out of medical school, you can work. But you just can't do complex things. For that, you need to go to residency. So basically, to sum up, I think that they don't get as harmed because of this, because they are basically obligated to go to residency afterwards. And in residency, you probably get to practice a lot. So it's not such a bad thing after all. You know what I mean?
I believe it must be something like the step 3 in the United States. You have to take the step 3 to work unsupervised. And this is a kind of difference we don't have in Brazil. Supervised and unsupervised work. Once again, in Brazil, almost every work is unsupervised. And I'm going to justify why I found it funny when you said that you can't work at some areas like emergency unless you have a residency. And the reason I laughed at that is because here in Brazil, emergency and critical care are the most common areas for people who have just graduated to work. The residencies do exist, but the emergency medicine residency is very recent. It has like 10 years. The critical care one is older. But in some parts of Brazil, I'd say we see most of the people working with critical care and emergency medicine are brand new MDs, are people who have just graduated and haven't even started residency, for example.
Yes, that is so true. And I think it is insane. And I think it's more of something that you, as a doctor, as a medical doctor here in Brazil, should be aware of, because people will offer you jobs. They will offer you those kinds of jobs where you will have no resources after, first of all. And you will be working with very critical patients. And for example, in a very small city, a very small town, where you don't have a lot of resources, they will offer you those kinds of jobs. But I think this is more of a good judgment that you as a medical doctor should have, and not accept those things, even though they are allowed. You're not prohibited, to do those things. It's allowed here in Brazil. You are allowed to accept a job in emergency or in critical care. There is nothing that they ask of you. So I think it is very risky for you to accept a job as a recently graduated doctor, medical doctor, because you basically don't have that experience. But here in Brazil, the only thing that stops you from going and working on patients that are critical and in emergency, basically what stops you is you not accepting the job, because the opportunities exist. They will offer you a job in a very small town in the countryside with no resources, um, and you will basically get a lot of emergencies because that's their only place that they have to go and be seen by a doctor. And I think that you, as a medical doctor who has recently graduated and have no experience, it is your job to not accept this opportunity, because even though sometimes they pay very well, and even though they are offering you this opportunity, and even though you are allowed, because I don't think there is any, something regulated, or there's not a regulation that you need to follow for you to accept those kinds of jobs. Even though you shouldn't accept it, you shouldn't accept it because it is very risky, and you could even get traumatized and never go back to work again. I know people who have accepted opportunities like this and who have faced very, very serious problems with patients and not having the resources, not having the experience, and they got traumatized and never went to work again. So even though you are allowed to do, which I think is a very insane situation, even though you are allowed, in my opinion, you shouldn't take those jobs. Talking about my own experience right now, I have just recently graduated. I have been offered very nice opportunities, and I have been offered not so nice opportunities in this aspect. And for example, I was offered a job in which there were only 2 doctors on call, and one of them is not required to be an emergency doctor. And because we do have the residency here in Brazil. And I didn't take that one because I was like, at least I want to have someone who is comfortable with emergencies to be there with me, in a hospital. And I have been offered jobs where I have 5 other doctors, 6 counting me, and an emergency doctor. And that's the opportunity that I took because, I want to be safe. I really want to learn emergency, and I want to be confident with emergencies, but I want to watch it first. I want to do it. Maybe I want to do a procedure or something like that supervised first, and then get confidence maybe after 1 year, 2 years. I don't know. It's very personal. And then I will be able to accept a job like that, or maybe not even. Maybe I would have to go to emergency medicine residency to do this. But what I'm saying is, if you're not confident, don't do it. But what is very hard is for people to have this kind of thinking. A lot of times people are just focused on the money, on the opportunity, on things like that, and they forget that these things are very, very complex and very complicated. And this is my opinion. But of course, we have different people who think in a different way. But this is the way I think.
I think this speaks a lot to perhaps all Brazilian doctors. I wouldn't say I was traumatized, but I would be lying if I said that my personal experience did not play a part in deciding to focus more on medical education and less on actual healthcare, on providing actual care to patients. It's undoubtedly much safer, much more comfortable. It has a tenth of the responsibility. So I wouldn't say I was traumatized, but I think you would be hard pressed to find a Brazilian physician that says they left university and went straight to work and were perfectly comfortable and remember these first days fondly.
Yes.
I very much doubt there is such a thing.
Yeah.
And that has to do with what you mentioned, that here in Brazil, we don't have to do a residency, contrary, for example, to the United States. And I was completely unaware of how things worked in Italy. But the residency in the United States, for example, surgical residencies are 5 years long. So you have almost a new med school
Yeah.
to hone your craft, be it surgical or clinical, and gather a lot more experience. Are you aware how long is residency in Italy? Do you have any idea how it works there?
I believe I was in surgery there, and they told me that it was 5 years surgery, but it varies from residency to residency. And what I thought was very interesting is for example, I was in general surgery. That's the one that I was in. But they have, for example, plastic surgery or, you know, all the other types of surgery. And you have to choose at the very beginning of your residency. It's not like in Brazil that you choose, for example, I'm going to do general surgery, and then after 3 years of general surgery, I will choose my subspecialty, kind of. In Italy, you choose at the very beginning. So I think this was very interesting. And I believe plastics is 5 years as well, but you know at the very beginning how many years you're going to do and which surgical specialty you're going to choose. You have to choose at the very beginning. It's not like in Brazil that you do general surgery and then you get to choose. I think I don't like this way because I'm a very indecisive person. So I would be very like, oh my God, I have to decide right now. And then what if I change my mind? But yeah, very interesting. And this is how it works there, at least for surgery, for example. That's the one I had more contact with.
The truth is, I think this is a complete mess. And I'm not saying I have a moral objection to it, I just think it's messy. I'm not saying it's wrong. But I think we have pretty much all these different strategies in all countries. Here in Brazil, we have both styles of subspecialties versus fellowships, even though we don't call them fellowships, and just going straight into a program. For example, we recently had that with cardiac surgery. Neurosurgery is a different specialty from general surgery. If you're going, for example, into urology, you take general surgery first and then
Yeah.
urology. But neurosurgery, I think, has always been a separate residency, a different one from general surgery. So you go straight into neurosurgery. And I think it's been like 5 years that cardiac surgery has been transitioning as well. So now you apply to cardiac surgery and it's like, I don't know, 4 or 5 years, rather then going first into general surgery and then cardiac surgery. So it's changed.
Yeah.
And we have both. And as far as I'm aware, in the United States, it's even worse because they have different programs with different strategies. So if you're going, for example, into plastic surgery or cardiothoracic surgery, you will have programs that have direct access. You just apply for plastic surgeries 5 years, or you have other programs that are fellowships. So you have to have general surgery. It's like I said, I'm not morally objected to it. I think this is wrong. No, I don't. I
Yeah.
just think it's a messy situation. It's
Yeah, yeah,
hard to
but
even comprehend what's going on.
yeah, I think Brazil is kind of messy too. You know what I mean? Because we also have many possibilities. You can you can, for example, do this is the one I think is a good example. You can do hand surgery if you are a surgeon. You could do hand surgery if you're a plastic surgeon. And I think this is it, for example. But it's a particularity. It's kind of like it's something that you will only know if you are in touch with, those specialties. So knowing what you can do depending on which specialty you can work at is kind of messy. Another example is blepharoplasty. Plastic surgeons can do it, ophthalmologists can do it, and I think dermatologists can do it also. Depending on the training that you do, you can do many things. So I think in a way, everything is messy. And you will only get to know what you can do if you are particularly inserted in that specific area. Because it's very messy. You can, for example, finish your orthopedics residency and then do hand surgery, or finish your plastics residency and then do hand surgery. It's so weird. It's so messy, as you said. But I think it happens with every country, not just Italy.
I have two more examples to your list. You have head and neck surgery, which could be from otolaryngology or from general surgery. And you have critical care, which could be either a clinician, someone from internal medicine, or a general surgeon, or an anesthesiologist. You could have either of the three specialties.
Wow, I didn't know about that one. You know what I mean? So you will only know those things if you are particularly inserted in those areas. So in a way, I think everything is very messy. Medicine is messy. It's like, this is something that I say all the time. I thought, as a medical student, starting off medical school, when I made the decision to, start on this path and everything, I was like, oh, nice. I decided to be a medical doctor and my path is chosen. I chose to be a medical doctor and then I don't have to worry about choosing again. And I hate choosing, as I said. I hate choosing because I'm an indecisive person and I love a lot of things. I have a lot of interests. I'm a very, I don't know, I'm a very interested person in a lot of, subjects and situations. And anyways, so then I was like, I have it all figured out. I'm going to be a medical doctor. And then I got into medical school and I was like, shoot, now I have to choose again. And there are basically 100 paths that you can take when you get into medical school. So, yeah, it's confusing. Medicine is very confusing.
And you have inadvertently, to your own demise, brought up a topic I cannot skip over. Because Stephanie loves to make some suspense on her Instagram. I'm not sure whether she has ever said which specialties she intends to go into, but
Yeah.
going to ask now. So, have you chosen your specialty yet?
No, I haven't decided completely, but I'm going to give you some hints. I basically want something that can be related to lifestyle in a way because I love this topic in general. I think that balance and having, working with preventive medicine is more like me. And it took me some time to figure out this characteristic that I have, to know myself a little bit better, because I did think that I was the type of doctor that would love to just treat something that was wrong. And then recently I have been working on getting to know myself a little bit better and figuring out that I like more the aspect of preventing disease from happening. So I'm thinking about something related to that in a way. So something that can prevent disease rather than curing disease after it is present. And I do have some areas on my mind, but I haven't decided completely, especially because I will work for a year and a half. So I'm not taking the tests this year. For those of you guys who don't know, in Brazil, we have residency tests at the end of the year, at the end and beginning of the next year. So kind of like December, January, right? So December, maybe some start in November. So I would say, for example, from November to February is when the tests take place. And you basically have to choose the universities, the hospitals that you want to take the tests at. And then you go in person and take those tests. And this is very different from country to country. In the US, it's a completely different process. For example, it's so different. You have the matching process. It's not a specific test. It's a bunch of tests that you take. They take into account your resume, your clerkship and observership experiences. In Brazil, it's not so much like that. In some programs, they do take your resume into account, but basically it's more about the tests that you take. Anyways, so I'm not planning to take the tests this year because, first of all, I haven't decided. Second of all, I'm getting married at the beginning of next year. Yay. So this situation, thank you. This situation also is something that I want to be involved in. Like, I want to be involved in planning the wedding and doing things like that. So I don't want to be like involved with residency at the beginning of the year yet. And also because I want to work and see the scenario that I like to work more at. If I like more the hospital, if I like what I like the most. Because even though during medical school we did have some experiences, we definitely don't have all the experiences that we can have. And so I think that working is fundamental, in my opinion, right? To have some experience and know what you like, right? So I will work for a year and a half. So I'm graduating now in July. So I have 6 more months until the end of the year, and I have the whole next year to work. And also another reason is because I want to work to make some money, to go into residency, because we don't get a lot of money as residents here in Brazil. I think in general, residents don't get a lot of money. So I do want to save up some money, during the year to basically live better as a resident later on. So yeah, I think those hints are enough for you to think about some areas. But I'm more involved with, right now, I think I will be more involved with, preventive medicine in a way.
The famous quote, "Why do you want to work here?" Well, I'm very passionate about not starving to death. Making some
Well,
money is indeed important.
what?
Making some money is indeed important.
Yes, exactly. Basically, I want to stay in Brazil because I love Brazil. We do have our flaws as a country. We have very messy politics, I would say. Not everything is as I would like it to be, right? Not everything is as fair as I think it should be. We have a lot of social disparity. We have many, many, many flaws. as a country, as a nation. But I believe in Brazil. I'm one of those, optimistics. I'm very optimistic about our situation, even though we are going through a lot. And because I believe that we have a lot of resources, I believe that we are a very rich country. And I love people. I love Brazilians in general. I think we are very hardworking. I think we are people that are like warriors, even though we don't have a system that helps. We don't have a lot of resources in the context of like education and things like that. We don't have a lot of that, but that makes us like fight for things. So I like Brazilians. I like the enthusiasm that Brazilian people have. Um, and also, I think there is a lot to do here. I think that we need people that are willing to work here and to make here better. And I respect so, so much people who want to go to other countries and just use their abilities to help other countries too. Because we are, even though we are separate nations and separate countries, we are humans in general. So I think it's very honorable and very nice for you to use your abilities in other countries. I respect that so much. But I also believe that our country needs people and people that are good professionals and that want to make a difference. So I want to stay here because of that also, because I love our climate. I love that we are tropical. I love that I live close to the beach. So basically, and my family is here. So the people that I am very close to are here, not just family, but friends as well, people that I grew up with. So those are my reasons. But again, this is so, 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 so personal. And I respect so much people who make the decision to live abroad because every person has a different reality. Every person, maybe to a person who doesn't have a lot of family alive anymore, or who is not so attached to friends here, or maybe this person thinks that they will have better opportunities out there, which is true, because in Brazil it's really hard for you to get good opportunities, or maybe you enjoy their lifestyle better than our lifestyle here in Brazil. I particularly love the Brazilian lifestyle, but some people don't. So my reasons are these, but I completely respect and understand people who want to live abroad. And that's why I was telling you before, I don't intend on taking the USMLE steps anymore because of this. I want to stay here.
Your opinion is surprisingly common. I actually hear that a lot from Brazilians. For
Nice.
good or bad, we seem to really like our country and our culture. Personally, I would like to experience living in other places. I'm not sure I would like to perhaps settle permanently somewhere
Hmm.
else, but you mentioned, for example, the climate. I've never lived somewhere that snowed, so I have no idea how I would react to actually having snow during my daily routine. So I would very much like to spend like some 6 months, a year living in some different countries and see how things go, see how I match each place. And to some degree, I think you have done that because you have lived in the United States. You went there and you worked, studied like a medical student, and you went to Italy. And in your specific case, it's even more, I'm not sure I would say interesting, but perhaps interesting because you have lived previously in the United States and you are an European and Italian citizen. So I believe
Yeah.
it wouldn't be very hard for you to move to any European country if you wanted to. you are a citizen of that country.
Yes. Yes, I am Italian. I do have the Italian citizenship, and I would love to spend maybe, you know, some time in Italy, as you said, maybe a year or a year and a half. I don't know. Um, and I believe in those experiences as something that expands your way of thinking, expands your mind in a way, right? So I think it is amazing for people to have experiences abroad. I think it is very rich. I think it is really, really incredible for you to go somewhere and experience and have have the experience of knowing other people, knowing other cultures. I think this changes you in a very, very good way. Um, and perhaps I will do this some time in the future. I will have a year or maybe a year and a half of an experience abroad. But as of now, I would say that to live permanently, I would choose Brazil today because of those reasons that I said. But also because I have had many experiences abroad, even being young. Let's say young. I'm 26 now, but I feel I'm like, oh my God, I'm almost 30. But even being young, I feel that I have had a lot of experiences with moving, especially not just moving abroad. I don't know if we ever talked about this, but I have moved like from house to house and city to city, counting Brazil and the US and blah, blah, blah. I have moved 17 times. 17. So I believe that part of the reason that I chose to just stay in Brazil and not have big changes for a while, big moves and stuff like that, is because I am tired of moving. I just want to be permanently somewhere and just build my roots in one place. I just want to stay and grow old in one place. Right now, this is my goal because of who I am, because of the experiences that I had, because I have had the experience, for example, of living with snow for 2 years and, well, 2 winters. And I didn't like it that much, although it's very nice. It's fun. I don't like having it all the time. So basically, the more experiences like this you have, the more you get to know yourself. So I think that even, this decision of like, I want to stay in Brazil and, making this decision and knowing what I want is because I blessedly, I could say, because I am blessed to have had these opportunities. So even though at the times that I had these opportunities, I was mad about them. For example, moving to the US was not something that I wanted. Um, Even though when this happened, it was a big challenge and everything, it was fundamental for me. So it was um, a great learning experience. And I learned so much. I learned about myself. I learned English. So any experience that you have abroad, you will get so much more than what you give. You will just basically be. I think when we go abroad, we are kind of like a sponge. We're just absorbing, absorbing, absorbing. And then the more information you have, the easier it is for you to make decisions, I think. So I'm very thankful and very blessed because I had the opportunity to have traveled abroad. And today, this is basically what made me want to live here and know what I want a little bit more, you know?
You mentioned you decided not to take the USMLE, and
Yeah.
I'm not sure whether we mentioned that yet, but just for anyone watching, the United States Medical License Examination are a test you take both to accredit your diploma and to be selected into the hospitals, into the universities. It's different from here in Brazil, as Stephanie said, where you apply individually for each hospital. Each hospital has its own test. And I'd like to know how it is in Italy because I have no idea. But that was my next question. Did you ever consider doing residency in Italy, for example? Did it ever cross your mind? I don't even know how the process works.
Well, it has never crossed my mind. Honestly, I have never even researched about the process. I didn't ask them, but I don't want to go to Italy because one, I will get married, and as I said, it's very personal because each person has, a different life. But in my case, my fiance is in orthopedics residency and he's almost done with his residency. So I think it would be even a little bit selfish of me to ask him to throw away his residency and do it all over again somewhere else, Italy or the US or anywhere else. And also because I think that having to learn another language, I'm not fluent in Italian. I do know some words, but definitely I would have to dedicate myself to like a year or even more of studying to go there and do my residency training there. And because I don't want to live there, I believe that any place that you choose to go to residency in should be the place that you intend on living at. Because to me, it just doesn't make sense to spend 4 or 5 years in a place where you don't plan on staying. Because during residency is the time that you make the most connections in your area, the most work, for example. You do a lot of things. People get to know you, get to know your work, your personality. You get to go to conferences, you get to do things. And then to move from there and throw all of that away, I think is just not the smartest thing to do. Obviously, some people do it when they don't get to plan this much. For example, they want something right now. For example, I want to stay in Brazil right now, but then 5 years from now, I finish my residency training and I'm like, I don't want to stay in Brazil anymore. And then you move, you know? But when you already know, for example, in my situation, I already know I want to live in Brazil. I think it's just not smart of me to choose to go somewhere and like, oh, and then in 5 years I will just come back to Brazil. I think it's just not, it just doesn't make any sense. That's why I don't intend on doing residency there.
That will be a contentious opinion. I definitely see your point, but a lot of people actually do it. Go to another country, for example, for residency and then come back. And I
Yeah.
definitely see the point because it takes a lot of years. So if you are considering, for example, marrying, having children, spending time away from your parents and other relatives, well, of course it matters. It's 5, 6 years are not a blink of time. It's not
It's a lot of time.
some time you just spend away and then come back as if nothing had happened. But it does happen a lot in people's decisions.
Yeah. Yeah.
You,
I think this happens a lot.
you mentioned, I think, a conference. I'm not sure what was the contest. You just mentioned the conference, and I'd like to backtrack a bit. Why did you choose the American College of Cardiology?
Well,
Why?
basically, I'm sorry, what did you ask the last time? You said when?
I was just going to rephrase the question. Why their conference?
Why their conference? Okay. So basically, what happened is I was taking a course with Dr. Henderson, the meta analysis course. So he has a meta analysis course, and then I was in this course, Meta Analysis Academy today, they call it. And in there, I made connections. Basically, I had an idea for a meta analysis, and then I told one of the tutors that was working in the course, and I was like, oh, look, I had this idea and stuff. Maybe we could do a meta-analysis about this and blah, blah, blah. It was actually something that a professor of mine told me, like he was curious about this topic. It was about poly pills. I don't know if you've heard of it, but for hypertension, instead of just giving 4 or 5 pills to patients, is it better to give just one poly pill with all of the, all of the medications in it? Does it improve adherence? Does it make systolic blood pressure better? Does it improve death? And so on. So I told this tutor about the idea, and he told me that there were 2 other students that had the same idea. And, each person in a different place of Brazil. And then he was like, I'm going to put you guys together. And then he put us together, and some other tutors joined this group. And the ACC application was very soon, like it was very close. So we basically had the same idea at different places, basically at the same time. So basically we formed a group, and other tutors joined this group, and the ACC application was very close. I think 2 weeks from that time that they put us together. So it was kind of like a race for us to apply and to submit the abstract. I don't remember if it was exactly 2 weeks, but it was very soon, like it was very close. And then we submitted this paper, this abstract, and after some time it was accepted. And why did I choose the ACC? First of all, because it was the first conference that was, the closest conference that was going to happen. Second of all, because it was really hard for me as a student to come up with an idea of a meta-analysis. And when I finally kind of had the idea, it was kind of in a discussion with a professor. And also I even asked him if he wanted to be in the meta-analysis, but he didn't want to, but he was very happy for me that I got in the group, and we, developed everything, and we did the paper. But it was very difficult for me to come across a good idea, a good meta-analysis idea. And I saw it as an opportunity. And at that time, I was very into cardiology. As I told you, I'm into a lot of things. I'm into a lot of interests. I get interested very easily. And cardio is very fun and very visual. I think cardio is very, you see things. There are tests. There are imaging exams that you can do. There are lab tests that you can do. So it's very visual and it's very fun. I think cardio is very fun. There's the EKG, that you see things with your eyes. Like, it's not as subjective as, I don't know, psychiatry, for example. In psychiatry, it's very subjective. But cardio is very objective. It's fun. And at that time, I was very interested in cardio. And then that's why basically we chose the ACC, because it was closest. And I chose cardio because at the time I was very interested in cardio. I even considered to do cardio as a residency. And I'm going to tell you, it's not off my plate completely. I've been thinking of cardio. And I think although we have a lot of cardio patients who already have, diseases, heart diseases, I do believe it kind of enters the preventive medicine area in a way, because the person has the disease, but you are preventing other diseases from developing. So in a way, I think that cardio is very, not very, but in a way it is preventive, I would say.
Cardiology is very visual. You are telling that to someone who does cardiac animations.
Yes.
Of course.
Oh my God. And your animations are the best.
Sometimes
Exactly.
people ask me why I make cardiac and lung animations mostly. And the truth, the most plain way to put it, is because they look the best. Hearts
Yeah.
beat lungs inhale and exhale. You have movement. Of course, I did, for example, videos on the hand. You also have movements. But sometimes people ask me, could you do a video on neuroanatomy? And well, first, neuroanatomy is not exactly my favorite topic. But that set aside, we don't have that much movement, so to speak, in the brain. Of course, you could represent something, you could go on the microscopic level, but one of the
Yeah.
things I like the most about animating the heart and the lungs is that you can see them moving. You can put movement to them and see what would be seen macroscopically if you could actually cut and look. And then
Yes.
you
True.
were kind of flirting with cardiology, and like 3 months later, you went to Genova and chose surgery for your studies. So, were you
Yes.
also considering surgery, or was there a different motive for that?
Well, basically, I was obligated to do surgery there because it was my rotation here in Brazil. So I'm not that into surgery. I was in the very beginning of college, but I think it is kind of like a general thing because medical students, when they see surgery, when they look at, ORs and surgical gowns and scalpels and things like that, that is exciting. So it looked exciting, from outside. And then when I started to really live the routine and see and talk to surgeons, I started seeing that that's not the kind of life that I want to have. But I do enjoy surgery a lot. I enjoyed watching surgeries in Italy. I enjoyed scrubbing in surgeries here in Brazil. I really enjoy the concept of surgery. I think it's very, it solves the problem, right? So it's very, immediately the problem is solved. It's not like giving a medication and waiting for it to take action. It's basically something that the problem is solved with the surgery. And I think that there are very nice aspects and beautiful aspects about surgery, but I'm not interested in having it as a specialty. But in Genoa's case, it was basically because I needed to do a surgical rotation for my hours back here. In this case, my university did not accept me going and having the clerkship be related to any other area other than the one that I was supposed to have here in Brazil. So basically, I needed to choose surgery because of that. But it was super fun. It was super fun. Surgery is fun. That's the thing about surgery. It's fun. It's visual. It solves the problem. But do I want to work with surgery? Not so much. That's one thing that even though I'm very indecisive about the specialty, about all of those things, one thing I'm sure of is that I don't want to do a surgical specialty.
Much of what you've just said is barely even an opinion, it's almost common knowledge. I couldn't agree more with a lot of it. Because, yes, surgery is exciting. One of the things a new med student likes the most is going into a surgery and watching it. And it is a different experience. It's not something you see on the street. So you see someone open, you put your hand inside of someone, and you come and you tell your grandparents, hey, I watched a surgery today. I touched a lung.
Yeah,
and,
yeah,
and
yeah.
it is the kind of thing very few non-medical people can claim. How many people can say they've touched a lung, for example, from a living person?
Exactly.
So if it is something exciting indeed, and I quite like surgery, uh, and I think one of a professor once said is that, quote, the beauty of surgery is that you take out the disease with your hands, end quote. And surgery
Interesting.
is very pragmatic. That's probably the most appealing thing about surgery. You have a surgical patient, you go into surgery, and often the patient improves or dies, and the problem is
Yeah.
solved. And of course, that's an oversimplification. If you go, for example, into transplant surgery, of course, to a large degree, you're creating a problem as well, because now the patient is going to have to be on immunosuppression and everything else. But as a whole, surgery is very resolutive, is very pragmatic. And
Yeah,
I,
that's
I,
true.
I almost lost my original point. Where I was going with this commentary? Oh, I remembered it. But one of the things you mentioned, and I couldn't agree more with that, is that interest in an area is different from appreciating the lifestyle. These are very different things. Sometimes we absolutely love the theory, the working of something. You just find it beautiful and interesting, but actually going there and being there and working the hours is an entirely different experience. Because even as med students, you rarely go, for example, into surgeries every day. You don't scrub every day. That would actually be a major accomplishment. Usually people battle to see who will scrub and go into the surgery. So if you are quite successful, you actually go inside one surgery every 2 3 days, and that would be a great rate of success, at least on my personal experience. So you don't actually get the feeling of what it's like, for example, to leave the hospital at 10 p.m. every day. That's the sort of thing you have to consider. That's not very much experience during med school.
Yeah. Yeah, that's also one of the reasons that I want to work for a year and a half, to know, to get the feeling of going to work every day at a hospital, or going to work every day at, primary care clinic. Here in Brazil, we call UBS, right? Basic health unit, I could call it here if I could translate it. But it's a lot different. The contexts are so different. And I want to have some experience in different types of services, because I want to get to know myself before I make a decision about going to residency. Surgery, it's good that I have basically discarded it, because it is a big, there are a lot of surgical specialties. So I think a big chunk of things have been deleted from my mind. So now I just have to focus on the clinical areas. And then even inside the clinical areas, I need to choose. So now I need to have a little bit of more experiences inside those areas and then decide. But what you said is, I couldn't agree more. Also, it is so different. So different. Admiring and thinking something is fun from actually living those days and those experiences inside of that area. I think it's two different worlds, and people are not so much aware of this. I think people are so excited about the interesting aspect of a specialty, and they forget to basically weigh the
cons.
the living aspect of that thing. So they are more focused on the interesting part, but how about the living part? They're not so focused on that. And then they make decisions. They make decisions about their specialties. And then when they start living their specialties, they're like, this is not what I was, picturing. This is not what I imagined, because probably the person only focused on the interesting part, on the, oh, I think this area is so nice. But they were not focused on, do I want to actually live and work with this for the rest of my life? Maybe not so much. So right now I'm very aware of this, and I'm trying to make my decision as aware of this as possible. I'm trying to be wise with this, because it's a big decision.
And you went, nevertheless, to your surgical rotation in Italy. And if I'm not mistaken, you went using the International Federation of Medical Schools Association, IFMSA, services,
Yes.
which is, I believe, linked in Brazil to CLEV. Am I correct about that?
No,
So,
they're not linked. CLEV is a one organization, IFMSA is another one.
and
They are
so,
different.
so how does it work? Did you contact them directly, or did your university do the proceedings?
Basically, we have a committee, a local committee in the university. So this is how they work in general. I think your university needs to have an IFMSA committee locally, and then they do the connections. This is how it worked for me. I'm not sure if someone who is in a university that doesn't have a committee, a local committee, if they can apply regardless of having the committee or not. Certainly, it makes it a lot easier to have a committee because they help you throughout the process. They help you to apply, they help you giving instructions and everything. So in my case, I'm going to say the process was kind of like fluid, but it was not easy because it's a lot of things. It's kind of those things that are easy, but it's a lot of work. It's kind of like there's not a lot of things go wrong, but you have to have patience, to get the documents, get everything that they need, be always aware of the dates, because we have a lot of deadlines
Deadlines.
you know, to basically meet. So we have to meet deadlines for a lot of things. So it is a very intuitive process, I would say, and it's very organized. IFMSA, I don't know about CLEV, but IFMSA is very organized. They answer fast if you send them an email, for example. So I think it was very easy, but it was a lot of work, you know?
Sorry, I thought they were the same thing. I'm not sure why,
Uh, yeah,
but
because they focus on the same thing, basically helping med students to have exchange experiences. But IFMSA is different. I can talk about the IFMSA process if you want, very briefly. Um, Basically, do you want me to?
go ahead.
Okay. So basically, they have a list of countries and spots that they have for each country. So, for example, Italy, we have 5 spots for July. And then they put, I don't know, like Argentina, 2 spots for May. And then there's literally a list of countries, months, and number of spots that they have for each month. And then you have a platform, an online platform, where you do your application. And then in that platform, you're basically gonna insert any certificates that you have. They have specific areas for each thing. So you can choose 10 countries and months, basically, based on your preference. And then you're going to put your certificates, you're going to put many things that help you to get points. So basically, you go to the place that you pass based on the points that you get, based on your score. And that score is based on things that you have done in your life. Papers that you have presented, or anything that you're involved with in college, any projects and things like that, they count. So you submit that application, and then they give you the results after some time. You pay a fee. I think it's 120 reais. You pay the fee and you apply. And then a couple of weeks after, I think, they give you back the results. They basically have a list of the people that were approved for each country and which month they were approved to go. All the exchange experiences are 4 weeks long. It's always 4 weeks. They give you back the results, and if you have not been selected, or if you've been selected to a country that you don't want to go to because you chose 10 countries, you can apply again for the remaining spots. So after people have accepted the spots that they got, there's still remaining spots, and then you can apply again. And then you keep applying until you get the place that you want to go to. Basically, that's it. And then when you are accepted based on your score, you already are kind of assigned to that country. And then that hospital, that country has specific hospitals that are linked to IFMSA. And each hospital and each local committee, like I have in my university, each local committee has their own requirements. So then you have to follow their requirements after you have been selected to go there. And then each country will have their own requirements. For example, in my case, I was not required to speak fluent Italian, but I was required to have a B1 or B2 level of English. So you need to attach, for example, an English certificate. It could be TOEFL, Cambridge. They give a list of tests that you can upload. And basically, you have many things that you need to provide. So, for example, health, insurance, you need to have your vaccination card and things like that. But that part, as I said, is not difficult. It's just annoying. You know, you need to come up, you need to provide them with a lot of documents. It's, a lot of work, but it's not hard. And they are very understanding, depending on the people that are going to have you there. They are very understanding. They wait. If you are not able to get the certificate on time, they will wait for you. They're very easygoing after you pass. And then you pay another fee, which is, I think, 500 reais, and that's it. And the very nice thing about IFMSA is that someone will host you in their home, or the university will provide a place for you to stay. They will have like a student dorm, for example, which was my case. So they will basically give you a place to stay and 1 meal per day. In my case, they gave me like lunch tickets. So I could have lunch every day at the university canteen, for example, and, that was very nice. But the thing is about my committee, and I think the regulations that I had to follow was I need to host someone for 4 weeks. Someone who is like, so it's kind of like a give and receive experience. So you receive a place to stay, you have all of that, but then you also have to give someone a place to stay. So it's kind of like literally an exchange thing,
the legitimate exchange program by the letter.
Exactly. It is legitimately an exchange. So in August, I'm actually hosting a Portuguese student, which is very nice because she speaks our language. So it will be nice for her to be here, and she will not go through a lot of the challenges that I had to go through in Italy, because not everyone speaks English, and it was difficult for me to get by. But in her case, she speaks Portuguese, but I'm going to host her in my home. So basically, that's how IFMSA works.
What you've mentioned sounds a lot like the process I'm used to, so I'm still not convinced IMSA and CLEV are not the same thing. Because it really sounds a lot like, I tried it once, I wasn't accepted because there was some kind of score, and actually hosting someone scores really high. So unless you host someone, you couldn't get enough score to go anywhere. And I'm not sure if it changed or if it's a different organization, because you went first and you are going to host later. But I did
Yeah.
have some experience with it, even though I wasn't selected, because for 4 months, for example, I lived with a colleague of mine who hosted two people who came through this project. So they
Mm,
were a female Portuguese med student and her
nice.
boyfriend, a Dutch med student. I think that was that. And it was quite fun because actually she was the hosted one. She was in the program and he accompanied her, I believe. So he
Mm,
actually paid my colleague to stay at the house as well.
nice. That's
His
nice.
girlfriend was staying through the program, but he came together and stayed by actually paying rent.
That's nice.
And it was an interesting experience. That was, I think, like 2017 or 2016. And we did get the chance to talk a lot. We had some dinners together. And it was interesting. She spoke Portuguese, of course. She was Portuguese, but he was Dutch. So usually when we were all together, we spoke in English. And he even spoke French. So we once
Wow.
went to, we once went to dinner and we started talking in French during dinner.
Wow, that's nice. That's nice.
And that was a dinner we talked in French. I didn't speak Dutch. I believe not even his girlfriend spoke Dutch. So
Yeah.
no one there was speaking Dutch. But I did have some experience with this program, even though I wasn't technically the host. I was cohabitating with them, and
Yeah.
I didn't get to go. But I saw this sort of program happen a lot in my university, and I saw a lot of people host people and also go to other countries. So
Nice.
it is interesting. It is an interesting program, and
It
I'm,
is.
as I said, I'm still not convinced it's not the same thing. I believe we're probably talking about the same program.
They're very much alike. I think, just because they are, they have the same purpose, basically. So they are similar.
But you've mentioned, I talked about the languages, and you've mentioned they don't require fluent Italian, for example. And that's a kind of problem I've heard from some people that went to study abroad. People go to study in Russia, in Greece, for example, France usually requires French. But
Yes, French, yeah.
many of the countries that have less commonly spoken languages, like for example, if you go to Bulgaria, people don't usually expect you to speak Bulgarian. The same applies for
Yeah.
many other countries. So perhaps
Mm-hmm.
France and Germany require French and German, but many countries don't require their own languages. They require only
Yeah.
English. And you can
Yeah.
be too strict, but you can also be too lenient. And what many people have said is that they go, for example, let's say, to a random country. They go to Romania and they don't
Yeah.
speak Romanian, and the requirement is to speak English. And of course, they won't be denied, but no patient speaks English. So they can actually collect history, for example. What was your experience
Exactly.
like in Italy? Did patients speak English? Did
No.
rounds happen in English? How was it?
No. No. People were so nice to me, doctors and students. And the doctors and the students, all of them, they spoke English, but not patients. So rounds and consults and things like that were all in Italian. And then afterwards, they would explain to me what was said. This is not something that made my experience bad or anything like that, but I think I would have had a much richer experience if I spoke Italian. One of the exchange students that was there, he was another Brazilian student as well, and he spoke Italian. So I think for him, the experience was richer, definitely, because he could understand patients and things like that. So yeah, it's very nice. If you can learn the language, if you have time to dedicate yourself to that, I think amazing. It's not fundamental if they don't require it, but I think it makes your experience much better. And I actually want to learn Italian. It kind of like triggered something in me being there and stuff and seeing the language in person. And being Italian and not speaking it, it makes me so sad and even a little bit ashamed. But I do want to learn, and I think this experience definitely triggered something in me.
We also had an Italian, a recent graduate. She had just become an MD, much like you,
Nice.
come to my university when I was on my surgery rotations, and she had just
Nice.
graduated, and she used these programs to come and spend like another month here, exactly because she wanted to do procedures. She came to Brazil precisely because she wanted to try her hand at suturing or getting a central line and these kinds of things. And personally, I don't think it worked very well for her because it was a university hospital, so there are lots of students.
Yeah.
Usually, when you go to some random hospital where they actually need workforce, they are more accepting to procedures. Usually, when you are at university hospital, you have a any kind of remotely interesting procedure. If you're going to place a central line, there are usually 8 students waiting for the opportunity to do it. So, personally, I don't think it
Yeah.
worked that well for her. But at least
Yeah.
she got to know Rio de Janeiro and our
Yeah.
hospital, Gafrengili,
That's
was,
nice.
I bet it was a valid opportunity. And
Yeah.
since we are talking about languages, we are talking just now about speaking Italian and English and other languages. We cannot overlook the fact you have an Instagram page, a project of teaching medical English to Portuguese speaking Brazilians. For anyone that doesn't
Yeah.
know, we speak Portuguese in Brazil. That might be shocking, I
Definitely.
know, but yes, we do.
It might happen. We never know. Yes, yes. I'm very passionate about teaching. It is one of the things, it is one of my main interests. Repeating again, I love many things, and this particular thing, teaching, is one of my main passions in life. So, whether it's medicine, whether it's English, whether it is medicine in English or in Portuguese, it is one of my biggest passions. And I started this project during the pandemics, and I never knew that it could get this uh, not big because I'm not huge, but this that it could take up this much time in my life. And I never thought that it would be something that I would love so much to dedicate myself to. But this is the thing about getting to know yourself, right? You start finding out things that you enjoy and things that you want to improve and things that you want to work on. And I think that it only happens when you're open. So I remember starting, and I knew started to talk to you and develop this friendship that we today have because of this. And this happens with a lot of people that I end up connecting with. It happens because of this project that I have. So I think that when we are open, right, when we are open to knowing ourselves better and to basically trying out new things and things, I never thought I was going to be a medical English teacher. I had been a teacher before at an English school when I was 18, but I never thought I would be an English teacher again, let alone be an medical English teacher. So things happen when we are open, and even talking about these abroad experiences that we talked about today, I think people should be open to having these experiences because you learn so much from them. And I think this is what happened with the page that I created. And now I have many dreams and plans and things related to this page that I never thought that I would have, right? So, yeah, this is basically it about the page.
What was the turning point for you to start your page? I can say that for me, it was when I was studying for the USMLE, and I saw, for
Yeah.
example, infectious diseases, and I saw that measles can also be called rubella, and rubella in Portuguese means rubella, which can also be
Yeah.
called German measles. And by that time, I was already fed up with it.
Yeah, yeah.
And I said, well, I'm going to make a video to clear this up, even for myself. I need to put
Yeah.
it into something solid, into some media to clear it up for myself and, if applicable, to any others. And that
Yeah.
was the very beginning.
Yeah. In my case, it was basically because I was at a time of my life that I wanted to produce content in social media. I think it was the whole pandemic thing that people wanted to start creating content. So I wanted to create content, didn't know what to create. And then there was, I created an Instagram and I started to create mental health content, very random, but I enjoyed mental health a lot at that time. And then there was a time in which the content was very random. And then I saw this prompter challenge. I don't know if you know what a teleprompter is. It's
Yes.
when
Well, I do. I
news
don't know if the
people.
public does.
Yeah, exactly. So there was this prompter test in which you had to read really fast this text as if you were a news
Presenter.
reporter, for example. Yeah, news presenter. And then I did it, and a lot of people started to compliment my English. And then I was like, oh, I was an English teacher in the past. Maybe I could produce English content. And then a friend saw it, and he was like, well, you are a medical student. Why don't you put those two things together? And I was like, okay. And then that's how it started, basically.
Yeah, it's really fun teaching and working with the internet. Here we are on a Monday afternoon. We've been talking, I'm here sitting, we've been talking for 2 hours, and I can write this off as work.
Yeah,
I've been working really hard this afternoon. It's I could say something very similar about the animations, even though it takes sometimes a lot of effort. It's quite fun, and to all purposes and effects, it is work. It is a serious work. So it is something really fun, really interesting to do. And I saw you mention today on your Instagram, of course, for the most obvious purposes, right before our talk, I stalked you to see if you had any new announcement I should talk about or anything like this. And of course, you do. You created great suspense about something you are going to announce. And well, you are going to announce it tomorrow for me. However, this podcast is only airing 1 week from now.
that's
So,
true.
if you want to comment on your announcement, today is actually July 11th,
That is
not
true.
July 3rd. So, would you like to mention what was the great announcement you made 1 week ago?
True, true. Well, the announcement is, and I thank you so much for the opportunity of talking about this in your channel, on your channel, because, I admire your work so much and it's such an honor to be here. Basically, I'm creating a community. It is called MEI Community, and MEI stands for Medicina em Inglês, which the translation would be medicine in English, which is the name of my page on Instagram. So the name of this community will be MEI Community. And basically, the intention is to create a space, to create an area, to create a community where people that want to study medicine in English go to study. So basically, I want to make videos about conditions, about diseases, and very practical situations and very practical videos about each one of those conditions. And as a learning place, obviously, it is a place for people to learn the medical terms in English. So there will be quizzes, there will be summaries, and tools for people to learn. And we will have a recorded class every 15 days, but on the week that we don't have a recorded class being released, we will have a live class in which people will be able to ask questions about the class that they have just watched. But it is an ongoing thing, so I didn't want to call it a course or a training because it just doesn't have an ending. Medicine doesn't have an ending, in my opinion, and I think everyone thinks this too. There's just not an ending. You just can keep studying. So I want to keep it as an ongoing thing, and that's why I want to call it a community, because also I want people to connect and to make to network amongst them, and to have my support to do that as well, to have I'm gonna be there all the time. I'm gonna answer people in a WhatsApp group. So basically this is what I'm going to announce. I'm gonna announce the waiting list today, not today. I have announced the waiting list on July 3rd. Today is July 11th.
I am going to have announced it.
Yes, I'm gonna have announced the waiting list, but the actual launching will be on July 17th, next Monday. Next Monday, counting that today is July 11th.
Are you heavily targeting it towards Brazilians, or are you planning on growing it on a more global scale, on a more global level?
Well, definitely it would be amazing to have people from other countries, and the course will be basically in English. I am actually going to tell people that follow me on Instagram, my public in general, I'm going to tell them and let them know that it is an advanced course. So I want people to have a basic notion, a basic understanding of English, of course. So the course will be mainly in English. There will be a video or two in the beginning, in the introduction probably, that will be me talking in Portuguese. But definitely those videos that I told you about, the diseases, the clinical cases, the clinical scenarios, all of that will be in English with English subtitles. And for my, Portuguese speaking public, which is the majority of it, I will give them a list of the main words that were mentioned that probably are different and they probably might be out of their vocabulary. I will give them a list with translations, but the main idea is for people to be immersed in the course, immersed in English. So definitely if you are an English speaking health professional, and you want to be basically in touch with relevant discussions and relevant subjects inside of medicine, and you want to learn more terms in medical English, it does make sense for you to be in this community, I would say.
Relevant question. Is it paid?
Yes, it is paid, but it is a good price. It's going to be a very good price. I'm serious. I can be biased because I'm the one doing it, but I think it's I'm going to tell you in dollars, maybe, because, we have people from all over the world watching your channel. So dollars would be maybe the main, coin. What do I say? Coin? Currency. The main currency that they might use. It would be, I guess, $300 for a year of access. So per month, it would be kind of, oh my God, I'm so bad at math. 300 divided by 12.
Well, less than 10. Otherwise, 10 multiplied by 12. I mean, less than 30.
Less than 30.
That's what I mean.
Less than 30. That's why we are involved in medicine. We don't need math. I'm just kidding. We do need math a lot. But
you practice CrossFit. Stephanie loved posting things about CrossFit some time ago.
Yeah.
I've also been doing CrossFit for like 6 months.
Wow.
And
Good to know.
It's it's one of the most fun things that even at my CrossFit, for example, people usually call me Doctor. That's my nickname.
Oh, nice, nice.
I've been nicknamed Doctor, but sometimes we are just putting the weight into the bar, and it's like how much weight do we have to put? It's like 120 here in Brazil use kilograms, but you could just multiply it by 2 for pounds, for example. It's like 120. So, but how much does the bar weight? 20. So no. Go back. I think we missed it.
Yeah.
Let's count it again.
Yes.
And it's no, for sure. I can promise. I went to medical school.
I can promise.
I can't do basic math, but I could show your diploma. Show you my diploma. I was accepted, and I finished the course. I swear.
Exactly.
Even though I'm failing at the most basic math.
That's me. That's 100% me. But anyways, it is less than 30. I think we are correct in this aspect. It is less than $30 per month. And what is less than $30? That's not even like a fancy lunch that you have, at a restaurant. So I think it's not expensive. In my opinion, I think knowledge is the thing that we should invest the most in. So I think less than $30 per month is fair. And it also is related to how much you value what you're going to get. But I honestly think, I honestly believe, and, in my very, very honest opinion, I am going to deliver something really good because I'm a perfectionist. So I'm doing my best with this. So I'm not going to deliver something, like I'm going to do whatever and then charge you less than $30 just because it's cheap and then I'm going to do whatever. No, I'm going to do something good. So it is cheap. In my opinion, it's very little. But I also understand that a lot of students especially spend a lot of money on courses and things like that. And just going to medical school is an expensive thing. So I wanted to be understanding of that. That's why I decided to charge not too high of a price, I think it's fair. What do you think? What do you think as a medical English teacher and doctor as well, medical doctor?
Well, if anyone else doesn't know this already, I also offer private classes. I'm currently charging $20 an hour. I have no idea how much I'll be charging when you are watching this video. And my personal experience, my audience is very widespread.
Yeah.
I have people in my audience in very different countries around the world.
Yeah.
And my personal experience is that the vision of cost is dramatically different based on where you are in the world.
Yeah.
I don't think it's expensive for a course in Brazil, for example.
Yeah.
Definitely not for the United States or Western Europe. I think it's a very reasonable price for Brazil, especially if you consider it will be a year-long endeavor. I think it may be felt as expensive in some countries that have devalued currencies.
Yes.
For example, we experience a bit of this in Brazil, but there are countries that devalue, there are currencies that devalue far faster than ours.
True.
So I don't really want to cite countries here, but for example, in Southeast Asia, we have many countries that have rapidly devaluing currencies.
Yeah.
So in some countries, like $300, yes, $300 a year might be too much even for a physician.
Yeah.
However, I would like to point that from what I know about medical university prices around the world, if we consider private for-profit universities, even in many of these countries, $300 would be relatively inexpensive when compared with the cost of attendance of med school.
That's true. Yeah,
Now,
that's
that was
true.
a really long answer for your question.
No, but I think it was perfect. I think all the things that you said are so accurate and so true, so true. And well, as I said, my main focus, my main public is Brazilian. So that's why I based the price on Brazilian people. But definitely, I do have the intention of growing the course and focusing more on other, students around the world. And then I would think of a different price, perhaps. And from there, I would, just keep going. But it will be something of quality, that's for sure. That's something that I can assure you. The price will be in reais, right? So that's why, but it is possible to sell to other countries because of the platform. They allow me to sell in dollars, for example. So it is possible for you guys to buy it if you want to. But right now, the price, the value, the price value is just based on the Brazilian situation. But definitely when I grow the course a little bit more and start focusing on other countries, definitely I will make some adjustments. But that's it for now.
Well, I've just forgotten what I was going to add to the discussion, so I will
No
have to
worries.
add it on our next talk. But since we've already mentioned then the United States and Italy, and we've mentioned your Instagram page and your course, your upcoming community. Since we
Yes,
mentioned your
that's it.
upcoming community, I think it would be a nice moment to end on a high note. We've just found out that we can do basic math. So I
Yes,
think if you've left until here, we can we can end it on a positive message.
that is true.
So thank you, Stephanie, for coming. I hope, thank you for making time for it amidst your graduation and eventual preparations for a wedding and all that's happening right now. Good luck. Have a nice ball by the month's end. And good luck on your career, now starting to work as a physician. And I hope it doesn't take another full year, or I'm not sure whether it was 1 year or 2 years. I hope it doesn't take another full year before we make our new episode here. I'd like to also have some major announcement. For example, the fact that I'm starting a podcast, which is a major
It
announcement.
is.
But if you are watching this, I'm afraid you are already aware of that. So thank you for coming. Stephanie, do you have any closing remarks?
No, I would just like to thank you for the opportunity. Also, well, I did make some time to be here, but you also did. You also made some time to meet me and to, ask me very, very interesting and rich questions to prepare this, to have this idea of helping many other people. So, congratulations for this idea. Congratulations for always improving, always bringing new things, always being willing to help other people. Every time we talk is so amazing. I really do hope that it doesn't take us another 2 years to collab again. Your work is, just incredible, fantastic. And I would just like to thank you so much for this opportunity and to, make myself very, very available for other invitations that you have for me. And I would also like to tell your public that if they need help with medical English, if they want to follow me, I will be there. If they want to ask me any other questions about the experiences that I had, if I could help them in any way, I'm here. And well, that's basically it. Thank you so much for having me.
Final question. Which is better, snatch or clean jerk?
Whew, hard. I think clean jerk. Snatch is very difficult.
Oh,
I think
I
it's
so much
beautiful.
prefer
It's
snatch.
beautiful and it's complex, but I think like the more complex something is, the more beautiful it is, and the more, nice it is, the nicest it is. the nicer, but the more difficult also. There are too many steps to a snatch.
Maybe I've been doing my snatches incorrectly.
Well,
But
well,
clean requires you to get the right position. You need to go right into the movement. Snatch is more practical. You push it. It's more like surgery. It's
well,
pragmatic.
yeah, but if you cut it into steps, you're gonna see that there are many steps to a good snatch. And the clean jerk, well, it's also a little bit difficult, but it stops here. There is not there isn't the next step of like raising your hand and stuff. So I think that's why I like it the most. But if I were to say about the one that looks nicer, I think the snatch looks nicer.
Okay, thank you. I will try to research how much is 300 divided by 12.
Okay,
But
let's do that.
until next time, thank you for coming and thank you for watching this episode. See you on episode 3.
Bye bye, guys. Thank you.